Hi there, I'm Dr. Desiree Clement, and I'm the director of the FNP program here at Emory University. We are excited that you are interested in this FNP program. It is currently nationally ranked number 3 as of 2022, and it's the largest out of all of our APRN specialty program options offered here at Emory. Why is that, you may ask? Well, currently there's a national primary care provider shortage across our country, and especially here in Georgia. And per the research, FNPs can take care of 85% of all primary care needs. So it has become a very popular option because it includes didactic and clinical content from what we call womb to tomb or cradle to grave. So yes, you can encompass and care for people across the lifespan. So either individual care or for their families. This program is outpatient focused. It is not an inpatient hospital program. And in fact, there is currently a movement for role delineation for FNPs to be mainly all outpatient focused with their acuity level on the type of patients they care for. There is a strong emphasis in primary care as being a part of our role preparation. Therefore, if you are interested in working inside the hospital or doing more inpatient management or emergency management, then I would recommend applying to one of our other programs, either the adult Gero acute care program or the emergency NP program. So with this, let me explain a little bit more about our FNP role. So not only does it cover a broad range of healthcare specialties, that are outpatient focused, such as cardiology, neurology. You might have an option to work in one of those areas, but it also can be completed in 4 full-time semesters if you're going for the Master's of Science in Nursing degree, or 7 semesters if you're doing the Post-BSN to DNP, Doctorate of Nursing Practice degree. We also offer a part-time Master's MSN option. You must have your RN before you start the FNP portion of your program. Students have the opportunity to work with rural and migrant populations and also in urban and private practice care settings. This program is 49 credits long, and the clinical plan is now to do 720 hours of clinical, which out of that 720 hours, you must do 200 hours of that spent in primary care of the adult. Common rotations include anywhere from primary care, urgent care, family practice, internal medicine, cardiology, neurology, endocrinology, oncology, occupational health, sometimes a women's health option, pediatrics, sleep clinic medicine, workers' comp areas, LGBTQ. It just really depends on what sites are available at the time of when you are starting into your clinical semesters and what the availability is at the time in our area that our clinical affairs team is able to secure for your rotations here in state. If we do the in-state clinical placements, then what happens is that we will help you find those. We will be securing those through our clinical placement coordinator. If you're interested in doing out-of-state placement options, then it would be up to you to find the preceptor, and that usually happens around your 3rd or 4th semester is when we plan for that. Or your latter 2 clinical semesters. And you would vet all the information and then bring it back to our clinical affairs team, and then they can help you secure the affiliation agreements. And if it's a state you can go in, because not all states will allow an APRN advanced practice nurse student or an FNP student to work in their borders if the school is not actually listed and placed there. However, we can help you maneuver through all of that. Clinical site placements, like I said, are based on availability. It's a rolling basis. So some semesters we may have more cardiology outpatient options or neurology outpatient options. It just really depends. Our goal is to try and make sure that in that 720 hours with our preceptor and our clinical site availability, and that you definitely will have a primary care placement to finish your 200 hours, some exposure at some point to peds or women's health, even though you definitely get all the didactic in it versus maybe a solitary placement there. And then also that we will offer you to have 2 to 3 specialty placement options or specialty care options like an urgent care, cardiology, respiratory, different ones. Again, we can talk about that more when you come into the program because I know it may be a lot to take in right now. Each student will likely also need to have 1 to 2 of their semesters outside of the Atlanta metro area for clinical placement. With the growing shortage that occurs nationally and also at the state level of clinical placements, and mainly because our priority is also on providing primary care in a rural care setting or other care management by an FNP in rural areas or underserved areas, then we often will have you rotate some out of the Atlanta area. Each student will also need to make sure they have a car. Unlike at the pre-licensure level or the undergraduate nursing level, where your clinicals are more at a group, done by a group or at one hospital in the area, we are the opposite. You do follow the preceptor schedule. They're done outpatient. And so they may either be inside Atlanta or outside of Atlanta. And so you need to be prepared for that. And because of that, and because you'll follow your preceptor schedule when you're assigned, then what we do is we try to stack your classes all on one day once you start into your clinical rotations, whether we have you attending it online or we have you on campus, depends on how the semester is going. But you'll know what that one day is so that you can use the rest of the days to do clinical. We also do not recommend, due to the rigor of this program and the availability needs you will need to have in order to finish your 720 clinical hours, is that we do not recommend you do a nurse residency program. Because usually if you start into one of those, it is a full-time program and you do not have control over your schedule. If you want to do a full-time work program, then we recommend you go to a part-time MSN option. We do not offer part-time DNP option unless there's extenuating circumstances. Again, this is a full-time program that with that, once you're in clinical, you really kind of follow that preceptor schedule. So keep that in mind. So we need your availability and school needs to be the priority. Lastly, upon graduation and completion of your clinical hours, we will be able to certify that you have eligibility to sit for either one of the 2 nationally recognized certification boards, either the American Nurses Credentialing Center or the American Association of Nurse Practitioners Certification Board exam. If you have any questions, please reach out to myself or to admissions, and we wish you best of luck in applying or moving forward in our family nurse practitioner program. Have a good day.